Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical here in Jackson, Tennessee, and I'm coming on this week to tell you about our exciting new topic that we have. It is actually our whiteboard topic of the week that runs every week, and so this one discusses joint pain, in particular knee pain, and actually do I need a knee replacement. And so one thing this handout goes into depth in is actually looking at osteoarthritis in the knee. And actually, a lot of you that have knee pain may not know that arthritis in the medial compartment of the knee is the most common cause of knee pain and the most common cause that people result to get a knee replacement. And so what is interesting here is that actually a lot of people think that it's the age-related process that contributes to the knee pain and arthritis. And while some of that is true, it's actually a stress response. And so if many of you have come in and have seen me in the exam room or come in for a report, I'll go over that because you're just not aware. So it actually, about 90% of our nervous system, which perceives the pain, doesn't actually perceive the pain. And so you go through your whole life with this dysfunction and stress, and you just don't know it's there until all of a sudden we have pain, and then all of a sudden we get an x-ray and the cartilage is decreased. And so one thing, if we can halt that early on and even get some good chiropractic care and other options that we have here, you can actually reverse that process and get you out of pain and better functioning. Now, one good paper that I just read that came out here in 2018 discussed that those that actually have arthritis in their back, okay, have an increased pain and arthritis in their knee. And so one thing is, if you go to many other chiropractors, they're all different. Now, one thing we should all be doing is treating both areas, because when you can actually increase mobilization in the knee, you not only get fluid and nutrients into that joint space to help get nutrients into that cartilage to help it flourish, but you actually can then get extension to the hip, which actually decreases the extension in our low back, which is, go figure, one of the positions that if we have arthritis in the back, that's really painful. So if we're treating both areas, we can eliminate that stress response. One other thing that we have, because we're very fortunate in this office, is we actually have a lot of different options for knee pain that many providers don't have. We actually have trigger point injections for the back, but also looking at the knee, we have Jing disc, PRP, and stem cell that is actually, looking at the research, being very effective for treating the knee pain and getting you hope that you may not have. So if you have any questions, please feel free to call us, and also reach out to us when we see you in the office if you want any more information about those services and what we can do to help you. So I hope you guys have a great week and look forward to seeing you.